Namaste, I am Dr. Srinivas, a vascular intervention radiologist. Welcome to Department of Intervention Radiology. Intervention radiology is a specialized revolutionary medical field. We treat multiple various medical conditions using only pinholes, wherein the patient will not have any scars or any stitches and will have a shorter recovery time with immediate pain relief. For example, if the patient is having any block in the arteries in the leg, so what will you do? Okay, so you can see this is an artery which is having normal blood flow. Okay, so in some patients who are having any problem in the arteries, they will have some blockage in the blood flow. Initially, then the block will be a small block which can be treated by some medicines. As the block progresses, the patient will start having leg pain, or the patient will start developing some ulcers or some gangrene. So in those cases, the blood flow can be completely blocked. So the patient will be having severe pain or severe ulcers. So in this case, without surgery, we can treat this block. How? The simple thing. So we are going to use something called as balloons. So the balloons will be inserted across the block, and we can inflate this balloon and we can open the block and we can establish the flow like a normal artery. So this is what intervention radiology does to your blocked arteries. In intervention radiology, we also treat varicose veins of multiple stages. Previously, varicose vein used to be treated with open surgeries where the patient used to have multiple scars or stitches and prolonged recovery time. Now, without any of those, we can treat this varicose vein with either laser treatment, glue treatment or sclerotherapy. So for example, this is a laser ablation machine. So using this machine, we treat varicose veins. How? We are going to use this very small fiber, laser fiber. So this, as you can see, this is less than the thickness of a coin. So this fiber gets inserted in the varicose vein, and entire varicose veins can be closed only using this fiber. That is the advantage of intervention radiology. In intervention radiology, we also treat multiple emergency conditions. Like for example, if there is a clot in your veins. So you can see there is a large clot in this diagram. This large clot can be treated in two ways, either by medical management or by intervention radiology. How? We are going to use this machine. So this is called aspiration pump. So this aspiration pump, when it is switched on, it generates negative pressure. Through this, we are going to connect a tube to this clot, and this can be aspirated out of your body. In addition, we are also going to use something called as metallic filters, which can be placed above the level of the clot, so that can prevent migration of the clot to your lungs and prevent pulmonary embolism. In intervention radiology, we also treat fibroids. Fibroids are traditionally treated by laparoscopy or open surgery. But in intervention radiology, we can treat fibroids without any open surgery or laparoscopy, or without any stitch or any scar. How? I'll show you. So this is a small tube. So this small tube will be inserted in the artery of your hand. So through this small tube, we are going to take another very small tube called as microcatheter, which will be placed in this artery. And these arteries are connected all over the body to the supply of the fibroid. So through this, we are going to inject small particles which will treat the fibroids and will shrink the fibroids. Most of the procedures in intervention radiology are performed using this advanced cath lab suite. So what happens exactly? So the patient will be lying on this table. Using the system of X-rays, we are going to capture the images of inside of the patient using this camera. This camera produces images which are displayed in this monitor. Using this advanced precision system, we can treat multiple conditions using keyhole procedures. In Valvanad Hospital, the Department of Intervention Radiology has all the advanced facilities. So if you or your loved ones are suffering from any varicose vein, any thyroid problems, or any stroke, or any varicose vein problem, or any fibroids, you can always contact Intervention Radiologist at Intervention Radiology Department.